Good afternoon and welcome to the Atrium Health Return to Work Town Hall Part 5. I want to take a moment to thank many of you who are returning to our Town Hall event. We have been receiving tremendous feedback from many of you about how valuable these Town Hall meetings have been, and we are very grateful that you're reaching out and letting us know. I also want to say thank you to some of the new folks that are joining us today. The word is spreading about our content and the speakers that we've been able to bring forward. And we've had several new members reach out and ask to join the calls. And so we welcome you here today to join us. Again, we're excited about this presentation. I'll be joined by 4 of my esteemed colleagues and subject matter experts. And you'll see they're from multiple areas of our organization, bringing us a different perspective on some of the experiences that we're either seeing or hearing about in the community, but also some that we're experiencing hearing about here at Atrium Health. Next slide, please. So my name is Megan Heyer, and I'm a vice president in the Population Health Division at Atrium Health, and we are the ones sponsoring this webinar today. Today's topics, you'll see, we're going to spend some time with some new things, some new solutions that are available to you. One of them is enhanced primary care services. And I know Ruth is also going to talk a few minutes on a new resource guide that will be coming your way as well. We're also going to spend some time talking about leading effectively through the adversity and uncertainty that we're all experiencing in this COVID pandemic. We'll spend some time talking about communicating through change. Again, many of our folks on the call today are in human resource departments and or connected to or have colleagues that are really challenged with how do we communicate through this change. And then lastly, we'd like to touch on the impact of delaying care. This is really an important topic from your trusted local healthcare provider. It is extremely important that folks that need care are getting care, and we want to make sure that you all feel comfortable with getting folks back into the healthcare system, and we're going to explain to you why that's so important. A few housekeeping items before we move on. We just want to remind everybody that today's session will be recorded, and we will be able to get you the link so that you can go back at any point in time and re-listen to today's topics or forward and share with anybody else in your organization. We also want to let you know that there is an email box that you can send questions to. That's COVID-19rtw@atriumhealth.org. So if you have any questions or inquiries about solutions, topics, or help that we may be able to support you with, please feel free to drop us a line at that email box. And lastly, there's been a functionality added to our town halls, and that's the chat function. So if you have a question for any of our speakers at any point in time during our town hall today, please feel free to type it into the chat box. We do have several folks that are going to try to answer those questions in real time as much as they can. I'll also be able to pull some of those questions forward at the end if we have time for the Q&A session. And if we don't address your question, please don't worry, because we will respond back to you with a list of questions asked by the audience so that everybody is able to get information. So without further ado, I'd like to introduce Ruth Christopolsky, who is our Senior Vice President of Population Health, and she's going to walk us through the enhanced primary care services. Ruth?
Thanks, Megan. Good afternoon, everyone. It's my pleasure today to not moderate and to actually present. And I'm just going to take a few minutes. Dr. Kirsten later on in the hour is going to talk about delay and the impact of delay in care. And what we wanted to do was provide you information on how we want to make sure that your teammates and their family members have access to the care and services they need. And so the three areas that we attempted to address was increased access, convenience, and safety of the services that we're providing. And so working cross collaboratively across the organization, we wanted to introduce to you all first some enhanced primary care services that we're providing. And these services are available at all of our primary care, women's care, and pediatric locations. And so first and foremost, we want to remind you that we take the safety of our clinicians, teammates, your teammates, and our patients very seriously. And we have instituted COVID safe measures at all of our locations, including all of our ambulatory practice locations. And so all patients are screened before being seen in our practice locations, and all of our employees are screened daily. We have extensive cleaning protocols in place to ensure that you, your family members, your teammates, and their family members are safe in our practice. And we are requiring all patients and teammates to wear face masks. So our expectation is that all that join us in our locations will be masked appropriately, unless there is a physical reason why it doesn't make sense or is not appropriate for them to be masked. Additionally, you'll notice all of our teammates that are patient facing will also have eye protection. So we're really trying to do our best to make sure that the environments that our patients and teammates are in are as safe as possible. The second thing is we want to provide services to our patients and to your teammates and their family members in a way that is most comfortable to them. And so we continue to offer in-person, telephone, and video appointments with each individual person's primary care physician. We really are working one-on-one with patients to meet them where they're at and ensuring that they're able to receive care the way that they would like to receive it. Additionally, we do have 30 plus urgent care locations across our footprint available. Those are all open, up and running, and following the same COVID safe procedures. And we do have 24/7 virtual video visits available for any acute and after hours needs, and those are available for both adults and children. So really trying to make sure that the access that's necessary for folks to get their healthcare needs met is available. And then finally, we're committing to your teammates and our patients that we will make appointments available to every person in primary care, women's care, and pediatrics within 24 hours. And so wanted to introduce these new commitments to you today to let you know that we are here to help you and to take care of your healthcare needs. And Dr. Kirsten's going to talk a little bit more about the importance of getting care when you need it later on. The second thing I wanted to touch on, and I want to thank Kim Ferguson personally, and then all of our Employer Solutions team. We've passed out and sent out a variety of links, a bunch of different infographics, information about the services that we provide and how we might be able to help you. And you probably received about 50 emails from Grady and others over the last 8 weeks or so. And so we pulled it all together into a single source of information. It's all tabulated and has page numbers. It's digitally available, and it has turnkey materials built in and embedded for you to use with your employees. So as an example, if you look at the worksite exposures and you click on the word sign, so anywhere there's a highlighted blue, it will take you to the infographic around signs and symptoms of COVID-19. And so all of the infographics that we've produced, washing your hands, how to wear a mask, how to stay safe, what's social distancing, all of those are available and embedded in this resource. And our hope is to get this out to you early next week. And then we will continually update the information as we learn more and as the COVID situation continues to evolve. But wanted to make that easily available to all of you, all in one place, and then a real easy place to find infographics that you can print out for your worksite locations as you bring people back to your work sites and to the office. So thanks, Megan, for giving me an opportunity to chat, and I'll turn it back over to you.
Great. Thank you, Ruth. Very much appreciate you switching to presenter mode today. And like Ruth said, some really great things available. That resource guide is coming soon, and we will get it to you. Again, the functionality is phenomenal. It'll really allow you to easily get your hands on things, and feel free to use if it's going to help in your workplace. That's really what the intent is to save the heavy lift on the employer's part, and allow you quick, easy access to trusted information. So thank you very much. And now I'd like to introduce Carla Lever. Carla is our Director of Employee Assistance Program, and she's going to spend a few minutes talking to us about leading effectively through adversity and uncertainty. Carla?
Thank you so much. I'm really excited to be talking about this topic today. I think that this is an interesting time for us. It has been quite a wild ride. You know, people are naturally resilient, but what our brains are hoping for is a period of stress and then a period of calm or peace. And I don't believe that we've had that. So for 3 months, we've been worried about this pandemic. And then more recently, there's been this brought to the forefront social injustice, and there's a lot of anger and fear and sadness over that as well, in addition to all the other things that people normally have to deal with. So this has been a time that has been increasingly stressful for people. So if you look at, next slide, please. So 7 in 10 employees have indicated the pandemic is the most stressful time of their entire professional career. 70%, that's really high. So as you can see, all 5 elements of our well-being are being affected right now. Career, people are worried about their careers. Our social lives have been disrupted, our senses of support. Finances can be difficult right now, even if they're not now, people are worried about what it's going to be like in the future. Our communities have completely changed, and physically, we're worried about our physical well-being. Next slide. So it's up to the leaders to bring order to the chaos. We are responsible for calming the nerves of those around us and providing hope. I think you really can't underestimate the power of that, and also motivating people. So we have to operate under these guiding principles. People come first. If you are a compassionate leader, you can lead people everywhere. Also, we have to connect people to their purpose, which is actually the next slide. Do you mind shifting to the next slide? Reminding them that everything that they do is important for the job that you're trying to complete, and then reminding everybody why you are, what your mission is for your company. And also staying supported, being supportive and staying connected to your employees, because you can help ease the fear. So if we can go back 1 slide, this actually requires a shift in thinking. The first shift is people's personal lives are suddenly important to you. It didn't used to be that way. We used to ask people to just leave their personal lives at home. But since many people are working from home, and even if they're not, people are living in their personal lives while trying to work. Now, that doesn't mean that we think you should be counselors. That's my job. But it does mean that it is important for you to know what's going on with them so that you can keep tabs with them and you can help them. The second shift we need to have is to remember that people will rise or fall to whatever your expectations are. So if you set high expectations, generally speaking, your employees are going to live up to them. If you believe that they're going to do their work and they're going to be responsible, generally speaking, they're going to do that. Leaders, next slide, need to set the tone. So not only is this a time when one more slide, please. Not only is this a time where you need to care about, oh, I might be, one more slide. I'm so sorry, mine are out of order. So we have to model professionalism and respect. Teach people how to engage in conversations in a diplomatic and non-confrontational manner. Build a workforce with a diverse voice. Establish inclusiveness as a core value. Basically, if you treat everybody with dignity and respect, you cannot go wrong. Next slide. Offer hope. Hope is the single most important thing you can offer your employees. If you are hopeless about what you're trying to accomplish or about the future of your organization, nobody is going to follow you. Make sure you set a goal. You let them know this is what we are trying to attain. Have hope, genuine hope that you can attain it. You are responsible for the energy that's behind that hope, which makes it very difficult to be a leader. Sometimes we don't have the energy that we typically do, and now would be a time when that could be happening. You have to dig deep so that your energy can propel your followers, your employees, towards your end. And also try to be as creative as you can. Next slide. In being creative, ask for their input. You know, you are not the only person who has to come up with ideas. And as a matter of fact, you're probably not doing the work that everybody else is doing. And so they're right in the best position to come up with creative solutions for the problems. You know, sometimes you do have a great idea and it's wonderful to get behind that idea. But if another great idea comes along, make sure that you get behind that idea as well. Because if employees are involved in decision making, they're going to back it and they're going to help propel it forward. Next slide. I love this picture of the slinky because it reminds me that I need to be a little looser and not so rigid about things. I don't know about you, but in my line of work, there has been new information, it seems like daily, sometimes weekly. But you have to be flexible because whatever you think you know right now may change in a minute's notice. And you have to be able to move with that. We need to be able to adopt better solutions as they arise. And we need to suspend judgment for when mistakes are made. They're going to happen. Let the mistakes fall through the coils and let the whole cylinder of the slinky stay intact. And that helps you stay on your mission and stay focused. Next slide. Be positive. You know, I saw a special years ago. It was some sort of reality television show, and there was a kid in it. It was like a nanny show, and the kid was really angry. And he said, "Life is not all flowers and sausages," to whoever was talking to him. And I laughed about that, and I laughed about that. And I still, every time life gets a little bit hard, I remind myself that life is mostly flowers and sausages. And that's how I can lead. That's how I can help people have hope for the future. Project your confidence. That will help people believe that what they're doing matters and that you all can succeed together. Make sure you are paying attention to small wins. Make sure you are appreciating people loudly, frequently, and in all the ways that you can. Appreciate people in private, appreciate people in public, but don't forget to appreciate even the smallest bit of help or positivity right now. Next slide. We are responsible for creating a safe workspace. According to OSHA, its mission is to assure safe and healthful workplaces by setting and enforcing standards and by providing training, outreach, education, and assistance. So there's been a lot of information about how to create a safe work environment with regards to COVID-19, and I'm sure we're going to hear more about that today. But here are some other things that I want you to consider. If you have not done it recently, create a workplace violence prevention training. I think that that's really important when tensions are high. And tensions are high for many, many reasons right now. Also, it's important to have a crisis plan in place. If many people get sick, or if you have a violent event in your office space, you need to be prepared for that and also use your EAP program. Next slide. I'd also like to talk about communication really quickly while I have you. So it's important that right now you are over communicating versus under communicating. Make sure that you're checking in with your staff members again and again. If you're having staff meetings, if you're just checking in with them in other ways, maybe one-on-one, you cannot lead effectively if you're not doing that during this time. And also, you need to be checking in with yourself. Please promote self-care. You know, you cannot promote it if you don't do it yourself. If your employees are getting emails from you at 3 or 4 o'clock in the morning, they're going to believe that that is what you expect of them. And please don't expect that of them. If they see you always eating your lunch at your desk and never taking any time for yourself, they are going to follow suit. If you do not get enough rest and take care of yourself, you are not going to be able to lead effectively. And then your staff is not going to be able to do their jobs effectively either, because everybody's going to be burned out. And that is a killer for any organization. Make sure you establish communication boundaries. That's really, really important. And also be compassionate to your people. Listen to them, make room for the thoughts and the feelings that they're having. And again, create space for mistakes. It's okay. This should be the season of grace. We're all trying to learn new things and adapt to this new time because our normal has been completely changed. Occasionally, you're going to see a troubled employee. So a troubled employee is not somebody who botched one assignment. It's somebody who has had a pattern of declining job performance when they had a previously satisfactory performance record. Once you identify the pattern, it is important that you immediately address that. It is your job as a leader to help people perform at their best. And so if you don't give them an opportunity right away to correct something that they need to correct, you are really not doing your job. So make sure you do that. Right now, because people are still working from home, or even if you are working from home, there's the danger of disengaged employees. And that's true in a normal situation as well, but it is more true now. And it's very difficult to spot if you're not seeing your employees on a day-to-day basis. So watch for changing patterns in communication, like missing meetings, slow or not replying to emails and messages, missed deadlines, or even just a lack of participation in team chats. If you're seeing any of those things, please make sure you reach out to them and try to connect with them individually and see if there's something going on, if it's just that they're feeling a little out of sorts, or if there really is something that's standing in their way. Next slide. 1 out of 5 people is going to experience a diagnosable mental illness in their lifetime. And so it's important that they have access to mental health services. It's also important that you don't attach a stigma to mental health when you're talking to them about it. If you have an EAP, it's a wonderful way to refer your employees to something that is completely confidential because of that stigma. If you don't have an EAP, contact me and I will give you one. I'm happy to provide it. But most of you probably already have one, and you know that they provide all sorts of types of counseling. They have licensed professionals who can address all sorts of different problems and also give referrals for long-term counseling or specialized care. Some also assist with leadership training, as does Atrium Health. But do keep them in mind when you're thinking about your employees and when you're trying to help them. If you neglect your people, they will neglect your company. But if you care for them, You and your company will all thrive. Thank you so much.
Thanks, Carla. We really appreciate you spending the time going through that. One of the hottest topics that we get asked questions about and are dealing with from an Atrium Health perspective is this response reaction to the current situation and our overall mental health. And it is something that is important, and it is front and center, not only for our Atrium teammates, but for many of the employers that we interface with in our communities. So we thought it was important to spend some extra time making sure that we had the conversation, making sure that you have a resource if there's anything we can do to help support you and any of your employees. We would offer the opportunity to be there for you. And make sure that everybody understands that we don't take the mental health of anyone lightly, especially as it relates to the current situation. So thank you so much, Carla. We really appreciate you taking the time. And next, I'd like to introduce Lucy Dean. Lucy is an Assistant Vice President in our Human Resource Department with a focus on the teammate experience. Lucy's going to take a few minutes and talk to us about communicating through change. So Lucy, take it away. Lucy, you might be on mute. Lucy,
Can you hear me now?
Yes, ma'am. Thank you.
Do you have an echo? Because I have an echo.
Yes, if everybody
How about now?
can mute. Try it again, Luce. Nope, Luce, we're not hearing you.
Center. Please enter a conference ID followed by pound.
All right, Lucy, I think we're having some trouble connecting. Sounds like
Sorry, I can't find it.
All right, we're going to move ahead. Lucy, if you can mute your phone, we're going to go ahead and introduce Brian Kirsten. Brian is our Senior Medical Director for the Emerging Care Division at Atrium Health, and he's going to spend a few minutes talking to us about the impact of delaying care. And hopefully, when we get done, we'll get Lucy reconnected and see if we can go flip back to her presentation. But at this point, Brian, are you able to log in and hear us?
Yes, I can hear you. Can you hear me okay?
Absolutely. Thank you so much.
Great. All right. Well, thank you, everyone. I think this is an extremely important topic. The COVID-19 situation is certainly front and center. It's every day on the news, and very important that we talk about this. But at the same time that this pandemic is affecting us in the city, in the country, and across the world, many individuals struggle day in and day out with chronic health issues, and those health issues could lead to worsening of their health conditions. And I think it's important that we don't lose sight of how important it is to take care of all medical conditions and find creative ways to do so. So I want to spend a few minutes to discuss this. So actually, I think you might need to back up one slide. I don't know if I want to hit 2 slides. Maybe not. Okay, well, we'll start on that slide. There's many different implications of delaying care, both short-term and long-term implications. So avoiding care for a chronic medical condition can lead to a worsening of that condition, and that certainly could impact long-term risk, but could also lead to an unnecessary trip to the emergency room, which could then lead to a hospitalization. As a result of that, could lead to a prolonged time out of work, and depending on the condition, reduced workplace productivity, and of course, higher treatment costs due to the hospitalization as opposed to managing the risk factors within the clinic. I do want to highlight a study that was done during a similar, although less severe outbreak in 2003 with the SARS outbreak, is that hospitalizations significantly increased following the SARS outbreak due to complications of diabetes. And this was due to decreased outpatient use of or management of that condition during that outbreak. So I think that highlights one small example of what we unfortunately may be facing as the days and months go on, now that we're several months into this pandemic. Next slide. So the health and financial impacts of delaying care are not only a worsening of a condition in the ambulatory space, but life-threatening conditions. What we've seen is that there have been a significant reduction in the number of stroke and even heart attack evaluations. And as you can see there, the stroke evaluations are down by 40%. We know that this doesn't mean that there are fewer strokes. Unfortunately, it is because the evaluations for stroke and heart attacks are not happening quickly enough or even making it to the emergency room at all. So I think it's really important that as we discuss some of the strategies on seeing providers within a clinic, it's also important to know that the emergency room is still the place to go if you have a life-threatening condition. On the next bullet point, you can see here that of the 650,000 cancer patients receiving chemotherapy in the US, around half are missing their treatments. And of the 150,000 new cases that are typically discovered each month in the US, most are not being diagnosed. And this is from patients not seeking care within their clinic to address a concern they have, but also, as you can see in the next bullet point, routine cancer screenings are not happening. And there are certainly strategies that we have in place within Atrium to reach out to our patients to make sure they have the screening tests that they need in order to potentially identify a cancer. And as you can see on the last bullet point, nearly 85% fewer living donor transplants are occurring now compared to the same period last year. Next slide. So Ruth mentioned this a little earlier in the discussion, but I think that it's important to highlight once again and over-communicate the fact that we are taking safety very seriously within all of our facilities. And when it comes to seeing any of our doctors within the outpatient clinics, the safety measures include screening with questions at the time of scheduling, at the time that we remind you of the appointment, and then when you arrive at the at any facility, we will be checking the temperature and doing a health screening at the time of check-in. So we're taking all necessary precautions we can to keep not only patients safe, but the employees as well, because we want them to be able to care for our patients. And so we take it seriously on both sides. Next slide. So we do know that it's a reality that individuals may not want to receive care, not feel comfortable receiving care, concerned that they may be exposing themselves by going to a clinic or going to the emergency room. The data is there. I just presented several examples of that. And so if that's the case, we want to be there for you to be able to help manage your health conditions, if appropriate, through different ways of receiving care. And that includes several virtual options, as you can see there on the screen. It can be as simple as a phone check-in or a video visit. And it really depends on the condition. As I mentioned early on, some of the data around the SARS outbreak of 15 plus years ago, the complications and hospitalizations from diabetes went up after the outbreak. Well, for many individuals, that condition can be easily managed through just a discussion with your provider on the phone or through a video visit. So by partnering with your primary care physician, you can certainly find out the best way to receive care. And we want to make sure that we are able to stay in touch with you, modify your medications if needed, and many times that can be done virtually. Of course, there are certain conditions that need to be evaluated through a face-to-face visit, and that's for us to help guide you through that process. So with that, I'll turn it back over to Megan.
Thanks so much, Dr. Kirsten. We really appreciate you taking the time and bringing that very important topic forward. I know it's one that continues to surface as we're out and about in the community with our local employers, just helping to remind everybody that care is extremely important. Many folks with chronic conditions need to have that connection with their primary care providers and healthcare team, and we want to make sure that they feel comfortable doing so. It's extremely important for their health and for the well-being of everybody involved. So thank you so much. I appreciate you taking the time. We'll do a quick mic check to see if Lucy Dean was able to join us.
Can you hear me?
Yes, Lucy, great. Thank you for joining us. I'll ask Kim to tee up the slides for Lucy, and as soon as we do, there we go. I'll reintroduce you quickly. Lucy Dean is our Assistant Vice President of Human Resources. In her focus area is the teammate experience. So I will turn it over to you, Lucy.
Thank you, Megan, and I'm sorry about the confusion with the audio. I'm sure it was user error on my part. Glad to be with everyone today. Just as a quick summary of what teammate experience means at Atrium Health, my responsibilities are HR communication, teammate engagement, which includes our survey, recognition, events, as well as our teammate emergency care fund for our employees. So overall, we encompass all of that into the teammate experience. And I like to start this slide with this slide, which is just the basics. There's nothing profound here, but when my teams and I are working on communication strategy for the organization, internal communications, HR communications, we keep these all these elements in mind. We always lead with our mission. And if we are questioning where to turn or the source of truth for our intention, it always goes back to the mission. We do repeatedly share that there's no magic formula. While communication is crucial, and I love that both of the earlier speakers, Carla and Dr. Kirsten, mentioned over-communicate, which I agree with. Just like I'm a dietitian by background, so there's no magic pill for weight loss. There's no magic pill for communication. There's planning, there's following the plan, and there's a willingness to pivot accordingly, but there's no magic formula. Continuous learning is critical, and Carla mentioned, the importance of asking for input and constantly learning, and I couldn't agree more. Knowing how to pivot, I know I've mentioned this, but it seems obvious, but we all have to have a comfort level with pivoting in the space of change, being nimble, but not being frantic. And I think that's a key piece of success. What's happening today might not be happening tomorrow, as we've learned really quickly. And then I always add thick skin required. It's kind of meant to be funny, but no matter how connected we are, no matter how much of an expert we are, there's always someone who knows more. There's someone who will disagree with the messaging, disagree with the communication, and possibly be a barrier to success. And we just have to keep in mind that that's a good thing. That will make us better in the long run. The thick skin definitely required. We do look at communication as an experience at Atrium Health. I've included the mission again because, again, it's our foundation. When we're looking at content, we do have HR information, we have policies, we have organizational updates, and they have all been changing rapidly in this environment. And probably if I was going to redraw this slide, I would have the HR information, policies, and updates leading into or pointing an arrow to culture and experience, because there is a direct impact. One of the things that, oh, no, if you go back one, sorry. Thank you. I belong to, and many of you may belong to, the National Business Group on Health is one of my peer groups, and we met a couple of weeks ago just to do a check-in on how we're doing during this time. And it was Atrium Health and Cleveland Clinic, Memorial Sloan Kettering, Ascension. There were some big players in the conversation, and everyone had really smart, strategic, innovative ways to support their employees. And everyone is challenged by communication, effective communications internally. It remains a challenge even for the most sophisticated organization. And I would say that we all agree that this is as much art as it is science. And if we, take that as a truth, we're better at our job. And so we do constantly learn from each other. What we do all agree on is the next slide. excuse me, we have 5 generations working side by side in 2020, and that is a challenge for all of us. I didn't create the slide. I should have sourced it. I Googled it. There are a bunch of different versions. I like this one because it doesn't lead with technology or preference of communication channel. It leads with what is happening, the key events during the lifetime of that generation, which is such an influencer of the way people want to share and receive information. We have 5 generations, and like my dad's birthday's tomorrow. He'll be 81, and he was born in 1939. He is great with his iPad on social media with his grandchildren who are Gen Z or Gen 2020. So we can't make the assumption that just because they have the white hair on the left end of the slide that they don't have the wherewithal to use the technology. What we have to do is gain insight from their experience and overlay this is what we do at least, overlay this type of graph with our audiences. So at Atrium Health, we have physicians, we have clinicians, we have the non-clinical teammates, we have leaders, we have executives, we have academic people. How do they overlay with the generations for us to figure out how to communicate and over-communicate with each group? It can get really complex, but it's worth spending a good amount of time in this space. Next slide, please. If Ruth had told me I only had one slide, I would have picked this one. It's not really sexy, but it has the information that is the foundation for how we approach internal communications during times of great change. And I didn't mention all the pictures during my presentation are of actual Atrium Health teammates or locations or areas, because we decided a few years ago that if we're going to communicate well internally, we should use our own people as much as possible and as appropriate. So we're very proud of our mobile medicine sites and testing and screening sites that you see here. So internal alignment. First and foremost, you got to understand your business. So I'm in HR and I'm a communicator, I am not going to be effective if I don't understand the goals of our business, the definition of success, and our vision for the future. Second, during times of great change, there has to be a universal agreement within your organization on who holds the source of truth. So in normal times, so in December and January of last year and this year, we had HR communicating and corporate comms and privacy and other areas. The minute we get into dramatic change, that shifts to our emergency command centers, which is a combination of security and operations and really led by corporate communications in those areas. And as HR, we follow that. So we land on a daily communication from our emergency operations, and we follow the cadence that they set and the rules and the rigorous approvals that are in place during this time. And that works for us. The Cleveland Clinic, they shared that they communicate twice a day from their emergency command. They may not be doing it still, but during the a couple weeks ago they were. We do a once a day from our emergency command because we still can utilize other channels as long as they go through the rigorous approval process. The key is everybody agreeing on what the source of truth is and moving forward and following those rules. Next slide, please. Also, during high times of change, we do rethink everything related to communication. We go and assess. Now, some things are continue. This is your typical start, stop, continue slide. Other things are stop altogether or start new. We rework our existing channels for the time at hand. For instance, I said we use our emergency operations system center. We consider risk, the risk in over communicating, the risk in not communicating at all. We assess, this is my very technical term, of the new stuff and the old stuff, but what's temporary, what's long-term, what don't we know in terms of timing, and what do we need to pay attention to? And then track and measure, and I know I said it 3 times, I would have done a whole slide on track and measure, but a few years ago, our corporate communications at HR departments decided to start using a software called Banana Tag. It just happens to be what we use to track the open rate, the click-through rate, and the second open rate of emails. So we have certain templates and certain way we design our emails and our newsletters, and we can track that. And if the readership drops, the open rate, second open rate, or click-through drops, we trash it. We're done, we'll move on, we'll reassess. So you have to be open to that pivot of just, if something's not working, don't try to raise it from the dead, just move on and find something better. And then lastly, incorporating change management. That's our next slide. So Atrium Health, we developed our own change acceleration model through our learning and organizational development. Some of you may use ADCAR or one of the other certification change management models that are out there. We, in addition to the generational approach, we also look at this very carefully when we have a chance to incorporate it into our change communication. Where are we on the spectrum related to each of our target audiences? Where do we want, how fast can we get to the accelerate and anchor phase? And what gaps have we created that we need to go back and fill so that our teammates and our target audiences can get to the after stage as a whole unit? Next slide, please. And then this is just one of my favorite visuals related to our communication during change. So the left-hand side is where we start. You need the bulleted list. You got to have all the guidelines, policies, important, regulations, best practices, the list of items that teammates and leaders are hungry for so that they can succeed during this, unknown time that Carla outlined. The middle graphic is we've always had a pretty good culture of storytelling, and that's so important. But the stories have changed, and Carla and you've heard others talk about the sense of isolation. People feel isolated at home, working at home. They also feel isolated in their mask and screen and shield and gowns. So how do we tell some stories of success related to our teammates and how great they're doing and recognize them so that they can connect with one another? And then the third image is sort of where we're headed. So we do have a sense of caution fatigue, which is a science that's out there now being studied. People are tired of hearing, be careful, be careful, be careful. So how do we elevate them and say, you're doing a great job, so keep doing what you're doing? And that's what that last slide is. It was a fun one that a nursing unit took on their own, and we've used it a lot. So if I could leave you with one sort of thought, it all boils down to, if you can communicate honestly and you can communicate authentically, then you are more likely to gain trust. And I love what Carla said about you offer hope, right? It's part of our mission even. So you gain trust and you offer hope, which is really rounds it out to you're going to be more successful at fulfilling your mission if you do these three things, and then the goal and achieving the goals of your business. So I think that truth, transparency, and trust are sort of the foundation principles for what to think about when you're communicating to your internal teammates. I think that's my last slide.
Great. Thanks, Lucy. I am so pleased that we're able to get your mic situated. I did have the ability to preview your slides prior to this town hall, and I was very excited to hear you speak today. So I'm glad it worked out, and thank you for spending the time with us and helping us organize our thoughts around the importance of communicating and leading in that space. So we very much appreciate your time. And with that, we actually have one question in our chat that we would like to address prior to closing for the day. And I would ask Dr. Kirsten, the question that we are asked relates to the wearing of face masks and some of the conflicting advice that seems to be circulating around that. And so the question specifically asked, in some opinions, the 6-foot distancing is enough, even indoors, when others stress the importance of wearing face masks indoors, even with the 6-foot separation, because that's enough distance. Can you, or not enough distance, can you provide guidance on what the Atrium way is on this and what the CDC guidance is?
Absolutely, happy to. Yeah, the CDC guidance definitely supports both masking and physical distancing. I think that we talk about 6 feet, we talk about masking. I think it's an and, not an or. If you look at the studies that are out there, that is certainly the approach that we take within Atrium of both social distancing and masking. If you look at some of the recent article that was just published in the journal Lancet earlier this month, it took a look at more than 100 studies on physical distancing and masking, and it supported both. For physical distancing, it was greater than 80% reduction in the spread of virus from physical distancing. And the same holds true for masking in a separate study, where by wearing a mask, you can cut down the spread by somewhere between 67 and 85%, depending on the type of mask that you wear. So I think it's important, without running the risk of the slide we just saw of caution fatigue, is to stress being cautious. You can't say it enough, and I think it's important to continue to state it as we go through this, is that we can't let our guard down. It's still important to mask and to physically distance, and stress that to our teammates and employees going forward.
Great, thank you. And I know Dr. Kirsten's going to stay on the line for us, and we do have Dr. Cosenza, Dave Cosenza, that has joined us as well. I've got a quick question that popped in. I'm going to throw it out there. We may need to follow up on this one, but can we talk about Atrium's testing, and is Atrium considering the PCR testing for employers in the future, the pooling of testing? Dr. Cosenza, are you able to chime in?
Yeah, Megan, but you said the consideration of pooling of testing. I'm not sure exactly what that meant. I will tell you that we have a committee that is looking at expanding all of our testing options, and testing not only options in terms of how can we do more, but what other ways are there to do testing, which ways make sense for which populations. Right now, for the people on the line, if somebody is symptomatic, the gold standard would be considered a nasopharyngeal, which is the swab that goes fairly far back into the nose. It still remains our recommendation for when people have symptoms and you need to know for sure. But there are other ways to try to obtain a sample, and we are exploring the ability to stand up any way that we think will help us get people the answers they're looking for, recognizing that our lab is being very cautious in what's called vetting the tests. Right now, a lot of the tests that are out there are under what's called an emergency use authorization. So there's not a lot of validation of the data. It's usually manufacturer supplied. So as we stand up a platform, we actually validate it internally as well.
Great. And that's exactly, that pooling is a word that we're not familiar with. So I'm glad that you took that question on. And that's exactly what I wanted to share with the audience today. Is the work we're doing in the testing realm, and the reasons why we believe it's important, and some of the safety measures that we hold true to as it relates to bringing test availability into the market, and how important to get that right is. So thank you so much for stepping up and answering that question. And I would like to just take a moment and thank everybody that attended today and interacted. Great questions on the Q&A. Usually we get several 10 to 20 follow-up questions in our email inbox, which you see there on the slide, COVID-19 RTW@atriumhealth.org. So if you have a question or anything that we can help you with, please feel free to use that email address, and we will get back to you quickly. We want to make sure that we're there for you every step of the way as your trusted healthcare partner. So at this point, there are no more questions coming in. So we will go ahead and close for today. And again, we will continue to bring you town halls as you ask for them. We are open to content suggestions. So if there's something, a hot topic or something that you would like to hear us speak on, bring subject matter experts to the table, we would be more than happy to do so. Again, you can drop us a line in that COVID-19 RTW@atriumhealth.org box for suggestions on topics, and we will do our best to work them into the future town halls. So with that, I will sign off for today and wish everybody best health and stay well, and let us know how we can help. Thank you so much.